Good morning. My name is Dr. Barry Goldstein, and I've been a clinical nutritionist and a chiropractor for over 23 years. And clinical nutrition is the ability to treat the body using whole food vitamins. Now you ask, what does that mean? Well, a lot of our vitamins that we buy out of health food stores are all synthetics. Synthetics means that they're one components. It's like vitamin E, because we're going to be speaking about the heart today. Well, I'll relate that, is alpha-tocopherol. It is just not alpha-tocopherol. Vitamin E is a complex. It was meant to be eaten as a whole food. We take a lot of the wheels out of the car and mass produce it, synthesize it, and compact it. We Americanize it, I would say. You know, put a Cadillac into a small pill. Whole food vitamins, wheat germ oil, green leafy vegetables, have not just alpha-tocopherol, but alpha, beta, gamma tocopherols, lipositols, what we call F1 and F2 factors, E2 and E3 factors. Selenium occurs naturally within the vitamin food source or the normal food source. It is a complex. We were not meant to get vitamins individually. We're meant to get them as a whole. Our body recognizes them that way, breaks them down, utilizes them properly. And all those phytochemicals, coenzymes, and all those other components help us be healthier, a lot healthier. How do I accomplish this? Your body senses energy changes, without a question. Externally, you could be in cold water. It'll say it's cold. It'll shunt all the blood into your major organs. Senses. By the way, cold is a form of energy. We all know that. We just don't think of it that way. You're in a room where the ceiling is low. You don't have to look up. You feel compressed. You really do. You sense it. It feels weird. You are in a room and your back is turned and light comes through. You know there's more. You could have your eyes closed. You'll know there's more heat, energy. Energy, sun is a form of heat. It senses it inside your body too. That's your nervous system. It kind of tells you. Well, how do you think it knows the stomach's going wrong? There's some type of energy change neurologically. So we kind of tap into that. And I use your body using muscle testing. And it's a really simple technique. And I'd like to demonstrate and kind of show you guys what I do. Kelly, if you can come up. You can take your glasses off, my assistant. And which arm is good again? This one. That one, good. That arm, good arm. And I'm just going to take a muscle. It's really simple. And I'm just going to tell her to lock it. By the way, you can put this down. This is a muscle response test. It is not the strength of a muscle. We're not looking to hang on your arm. As soon as it gets a little mushy, it tells me something. I do have to teach people a little bit of how this works. Because I'll just have her hold her arm up, and I'm going to use my hand. And I'm just going to touch, and this is the back of my hand, the front, and I'm going to take the back of my hand and put it over. This is a major energy points, or your umbilicus, or your belly button. This is another acupuncture point. And I'm going to use the back of my hand and put it over there. It stays strong. And I'm just lightly doing it. I'm going to use the front of my hand. It goes down. And I'm not pushing hard. It gets a little mushy. Your body senses those things. And then I'm going to just take her. And by the way, I will test both arms, both legs. Make sure you have good integrity. You should be able to lock to about 3 to 5 pounds of pressure. Anybody. I don't care who you are. Okay? And I'll just touch the body as I go through it and touch. These are all brain reflexes. And this all stays strong. And I'm doing like a screening now on her. And this is where your pineal reflexes and your pituitary, and both of them, they are hypothalamus. And some will make sense to you in a moment. This is for master sinus. Close your eyes, Kelly. And this is for your eyes, your sinuses. Another maxillary sinus one, open. This is for your jaw. This is for your lower jaw. I'll touch the ears. I'll have a rest in between. Maybe someone might get fatigued just by holding your arm up. These are your glands. These are pretty obvious. Thyroid. This is what we call the mediastinum, and it's a lung reflex. These are lung reflexes. I'm going to have her touch over her left breast, and this is a heart, and we'll have her resist, and nothing's gone down. It's okay. You go through the whole body. It's a body scan. You'll touch where the bile duct is, where the liver is. It's over the organ. This is where your gallbladder is. This is where your stomach is. This is where your pancreas is. This is where your spleen is. Now, I'm not really touching hard, but it went down on spleen. I'll keep going. Because sometimes there's multiple things, and you need to prioritize. Because if you have 2 or 3 different organs, and that's possible because your body does shut down in series. Your heart, your kidneys start to not work right, then your heart starts to dysfunction. In other words, there's always sequences in the body. I'll keep going. So we know this is weak, and then I'll touch the small intestine. This is a big, broad one. I usually do this laying down, and I push into the gut a little bit to get a lot of tissue in here. And this is where the large ascending, and this is the transverse, called descending sigmoid, call it. On women, uterus down here, and her bladder is next. And it goes down on bladder. I don't have to push hard. That's showing me there's a weakness in the body. Energy could be high or low. What are we looking for? We're looking for balance. There's a way of pulsing energy off by using the arm too, by monitoring the energy. We won't do that here. So bladder is another one, and I can just touch it and it goes down. I'm not even pushing hard. And over here, a little personal, these are where the ovaries are. I'm going to touch her kidney in the back. Everybody knows the kidney's here. I'm going to touch the adrenals. I'm going to touch the other, elbow straight, and the other one. So far there's only two things. What would I address? Maybe both of them. It's hard to tell you. There are ways of prioritizing the body. These are called finger modes. It's getting a little deep, but I'm going to take her finger and have her put it right there in the middle of the thumb. And I'm going to have her resist. And whichever one stays weak is the one I'm going to address. This is now strong. This is still weak. I'm going to now think about taking care of her bladder. I have probably 20 different things for bladder. Before I would even do that, I don't keep these here. We also test them for stressors. Stresses, immune, parasite, fungus, bacteria, virus. Before I even do the support drainage of anything, I will then, see if the stressors, there's heavy metals. I will test there's all kinds of things to put to the body and see if that makes a difference in the muscle test. There are heavy chemical sensitivities. There are foods. We have a whole testing for different foods that react to your body and what will create a change in this test. I'm just going to go into just some simple testing today and look at her bladder and look at different remedies. And this is carbamide powder. You say, that's not a vitamin. It doesn't make anything stronger. It makes it weak. Your body tells me everything. This is something called Alboplex. It's, again, these are whole food vitamins, locked. Now, that makes it strong. I'm just trying to show you that she is an easy nutrition case. These may be one of the things I would use for her. It tells me that it's a strengthening tool. It will help her body. Okay, you can sit down.
Thanks.
These are very designed programs, I would say. They're like a tailor-made suit. They're very specific for your needs. Two people walk in with exactly the same symptoms, and they'll walk out with completely different programs. Completely different. Happens every day. I got allergies. I had 2 children yesterday for every person. By the way, if you are not a nutrition case, most likely this won't help you. If you are one, then nothing, in my opinion, works better getting yourself healthy naturally. Okay? There's nothing out there that's better. Let's talk a little bit about, I'm just going to go to the next board. Now, I know this is very different, and you must have an open mind to a different approach. Naturally healing yourself. And you have to maybe try something different. You have to have an open mind instead of just standardly taking drugs over years and then over years later taking a second drug and a third drug. By the way, by the time you get to the third or fourth drug, maybe the fifth drug you're taking, 2 of them are to handle side effects from the other ones. Okay? By the way, this is not a quick fix. It takes months. It doesn't happen overnight. If you're looking for the bang, take the drugs for the pain. Take the blood pressure. It'll make your blood pressure go down because it'll just make a diuretic and make you urinate more. They don't know about all the side effects. It's not treating why, what's not working, what we can do to help it naturally. There's been things out there for thousands of years that help it. We just are very geared towards medicine. Oh, it doesn't work? I don't care. I keep getting stomach problems. I'll just go to the doctor. I'll take those things when I have the problem. That's not very smart, right? By the way, overall health is the most important thing. Everything I give you is safe and natural because primarily, you'll see in some of those packets, it's whole food vitamins. It's actually just ground up food put in capsule tablet form. That's what it is. They have smells, they have colors, they're compacted, they just low, what I would say, no heat, no cold, lower dosage in the sense of what the actual vitamin, what the FDA would call a vitamin in there, because it's the whole complex. You don't need 1 billion units of vitamin E. You need a few units comparatively in a whole food content, whether it's wheat germ oil, green leafy vegetables. Okay. So they're very safe and natural. They're great just as well for little kids I treat, like I told you yesterday, up into elderly people.